Hi everyone, my name is Jen Canistra. I work in the White House Office of Health Reform. I am here with Nancy Ann DeParle, the Director of the White House Office of Health Reform. And we are here today so Nancy Ann can answer your questions. The questions were submitted after the President's speech last night to Yahoo News. Thank you so much, Yahoo News, for doing this for the White House. And we are also getting questions from Twitter right now. So please, if you haven't already submitted a question, do that, and we will try to get through as many questions as we can.
Great. Thanks for tuning in, and thanks to everybody for watching the President last night. I was there in the chamber. It was very exciting as he laid out his vision for health reform and what's at stake for everybody.
Okay, Nancy Ann, the first question was submitted to Yahoo News. It's asked by Maya. And she says, I've been hearing too much from too many people, and unfortunately, I'm very confused and a very concerned citizen. Is there any way you can cut down in so many words what exactly this new healthcare reform will mean for me as a working class taxpayer?
I hope so, and I hope that if you listened to the President last night, you feel a little less confused and uncertain about what we're talking about. So the President laid out sort of what the status quo is right now, with more and more people losing their insurance, 14,000 Americans a day losing insurance. The costs are skyrocketing, people having a hard time affording insurance, small businesses being really crushed by the cost of it. And he sees it as, and we all do here, as a real impediment to our country's fiscal future. And so then he laid out what we're trying to do here, what he's trying to do, which is to provide for those of you who have insurance, and I hope you're one of those people, for those of you who have insurance, to have real stability and security in that insurance with the market reforms that the President talked about in the insurance market, so that no longer can people be denied insurance because of pre-existing conditions. No longer could you lose your insurance because you get sick and they cut you off when you need it the most. And those kinds of reforms that are really needed to provide real security and stability to everyone who has insurance. If you're one of those people who's unfortunate and doesn't have insurance, then this plan will, for the first time, give you affordable, quality insurance, access to that through a new marketplace called the Exchange, where you can go and purchase insurance. And if you're lower income, you'll be able to get tax credits to help you afford it. Small businesses will also get tax credits to help them with the cost of providing insurance to their workers. Everybody will have responsibility under the new system. Individuals will have responsibility, if they can afford it, to get insurance, but they'll have a new way of doing it, and it will help to bring their costs down and provide high quality but lower cost insurance for them. If you're an employer, you'll have a responsibility to participate in the new system. The government will help provide subsidies, and we'll all have a shared responsibility. So that's basically what we're trying to do here, and I hope that will help you with feeling less confused.
Thanks, Nancy Ann. There were several questions on fines and the mandate. Thomas from Florida says, I make $12,000 a year before taxes. How do you expect me to pay a fine for not having health insurance and trying to send a son to college? And Marshall from Thousand Oaks, California asks, I find it frightening and repulsive that a proposed bill would fine uninsured citizens.
Well, again, in order to make the changes that need to be made to get healthcare costs under control and get everybody covered, we need to ask everyone to participate in the new system, and that means both individuals, employers, the government, businesses, everybody, insurance companies. And so for individuals, yes, we would be asking you, and the bills before Congress would be asking you to participate in the new system. However, you would have the ability to get tax credits to help you afford insurance under the new system. And secondly, there would be, it's true that there could be a penalty, but it would be relatively small, and if you are truly someone who, for whom the premium is just too much and you can't afford it, there will be an ability to get a hardship exemption, a waiver, as the President talked about last night, so that you won't have to do it. This is similar to the system that they have up in Massachusetts, where they do have a hardship waiver, and the people who need it have been able to get access to it, and that has worked out well there.
Great. We have a question that was submitted to Twitter, and it is, how will this plan be paid for without increasing the deficit or taxes? How do we currently have money to spare in a recession?
Well, the way we pay for it is that we're spending right now in our country more than $2 trillion a year on health care. If you look across everything, government pays about half of that, and private citizens pay the other half through their insurance policies or the the spending that they do on health care. So what we're talking about is in the federal budget, looking at the spending that we do in Medicare and Medicaid and finding ways to make that care more efficient over the next 10 years. So the 10-year cost of this, the President talked about last night, we estimate will be around $900 billion over 10 years. We can spend that money more efficiently. We can get rid of some of the fraud and some of the inefficiency. One example is something that happened last week that you may have heard about. The federal government, the Justice Department, was able to successfully conclude a fraud case against a major pharmaceutical company and collected $2.3 billion for the government, for the taxpayers, because they had been overcharging Medicare. So they were able to get that money back, and there are some things like that in this savings for this new program. But in addition, there are things like we've been paying very high subsidies to some insurance companies that provide HMO coverage under Medicare. About 16% of Medicare beneficiaries get their coverage this way. The rest of them receive it through traditional Medicare, but the ones that get it through the HMOs, the taxpayers are paying about 14% more than for the traditional Medicare program. So we're going to reduce the size of those subsidies to insurance companies because they don't really do anything to help Medicare beneficiaries, and that will help give us the savings that we need to help fund this new program. So about half the savings that we need to fund the new program and cover the uninsured come from the getting savings in the existing healthcare system. The other half will come from some new revenues, and the President talked about that last night. So that's how we pay for this. And we can do this without, as the President said, adding a dime to the deficit. He's committed to that. We're not going to go spending money that we don't have the way the Congress has done in the past.
Great. We have a question from Mary, who is a senior citizen on Medicare from Oak Park, Illinois. And she wants to know if President Obama will do anything to alleviate the high cost of Medigap policies. And she also wants to know how will she be helped by reform, and she currently has Medicare.
Great, Mary. Well, I used to run the Medicare program, so that's something that I really care a lot about. And as you heard from the President last night, so does he, and he wants to do everything he can to protect Medicare. So I can think of several ways in which this program will help you. One way is that as we bring down the cost of Medicare, your Part B premium that you pay every year will go down. For example, I used the example a few minutes ago about the Medicare Advantage payments to private insurance companies. As we bring those down, the cost that you're paying, if you're in traditional Medicare, you're paying probably $50 a year in additional premiums on behalf of the people that are in Medicare Advantage. So that will come down. And as we make other changes in Medicare to get some of the inefficiency out, the amount you're paying in premiums should be reduced. The other thing is that we're going to take steps to fill the so-called donut hole in prescription drug coverage. Right now, about 8 million seniors every year come up to that, hit that donut hole, and when they're in that coverage gap in the drug benefit, they have to pay for their drugs themselves, and for a lot of seniors, that's a real hardship. So starting next summer, we're going to reduce that donut hole by half, and then over the next 10 years, we're going to totally eliminate it, and that'll be something that'll benefit Mary, you, and other seniors.
April has a question about abortion, and she wants to know to what extent is it being covered in the health reform proposals?
Abortion is not covered. Abortion is not something that, there will be no government funding of abortion under this new program.
Okay, we just got a question to Twitter about tort reform. What kind of tort reform will the administration consider?
Well, we're not just considering it. What the President said last night is it's time to quit bickering. While he doesn't agree with caps, he thinks he wants to make sure that people who have been injured or have been the victim of a medical error are properly compensated. But at the same time, he's talked to enough doctors to know that many of them believe that it's contributing to that defensive medicine, that medical malpractice claims contribute to the costs of health care. So he asked the Secretary of Health and Human Services to go ahead and start right now on some demonstration programs at the federal level to give grants to states to do some testing of what ideas might work. There's an idea in Maine that I heard about, actually, that's a certificate of merit where there's a panel that reviews a case before it goes to trial, and that's an idea that might work. So we're going to test some of these ideas. Medical malpractice is really mostly governed by state law, but at the federal level, we can encourage some demonstrations that will help us to know what really works. And so we're going to move forward with that right away.
Okay, we have a question from Kathleen from Albuquerque, New Mexico. She was recently laid off after working 20 years for the software industry, and she has a question about options for the unemployed under the new health plan.
Well, she'll be able, first of all, one good thing that has happened in the last 6 months, and I hope that Kathleen was able to take advantage of this, is the COBRA program, the coverage program to help people who have been employed and had insurance through their job to be able to maintain that insurance between jobs. That was expanded, and the government is giving considerably more assistance to people to help them to maintain their coverage. So I hope, Kathleen, that you were able to take advantage of that. But one of the things that will be terrific about the new system is that right now, as Kathleen's case so well illustrates, if you lose your job and you had a health insurance through your job, you're really out of luck. It's very difficult to go out and purchase insurance in the individual market in most states. If you go in there as an individual, it's very hard, especially if you had a pre-existing condition. So what this new program will do will enable you, if you lose your job or you change jobs, or let's say you want to go out and start your own business, you'll have a way to go to this exchange or marketplace and purchase coverage. And if you have a lower income, you'll be eligible for some subsidies. But just the fact that we're pooling everybody together should create lower cost options for you and more choices. And that's something that will be available to people like Kathleen under the new system.
There are lots of questions about the public option. John from Chicago wants to know how a private insurance company can compete with the U.S. government when the government doesn't have to show a profit. And TC from Los Angeles wants to know more about what a trigger is.
Well, as far as competition, we think competition is part of the answer here. And the concern that the president talked about last night is that there are a number of markets in the United States right now, there are a number of states where there really is very little competition among insurance plans. He cited one state where there's a company that has something like 75% market share in that state. We want to see more competition. We think this exchange should help foster competition among plans that'll be offering benefit packages. But we also think that there's a place for a government-sponsored option that would compete with using the same rules, and it would have to have capital that it raises through its premiums, and it would compete with private plans to provide a good benefit. He thinks it would be useful to have that as an alternative out there for people who might choose it as a benchmark to look at whether they're getting good value for their money with a private plan. As he said, our estimates, based on what the Congressional Budget Office has looked at, our estimates are that less than 5% of Americans would choose a plan like that, but it would be a good option and would help to drive more competition, and we hope to drive down cost in the market. Now, the trigger idea is one that's being discussed in the Senate Finance Committee. They're the last committee to look at marking up a health care bill. They're going to start their markup next week, and they're looking at this notion of why don't we wait first and see how the private sector does and how the private plans do under the new system. And what we're trying to get here is an affordable option. And so they want to look at, in a state, if 95% of the people in a state don't have access to an affordable option, then they would view that the trigger would be triggered and a public plan could come in and operate. Because they'd be saying that, you know, if it's not affordable, then we need another option, we need a public plan to be in there competing. So that's one way of looking at it. They're also looking at an idea called a co-op, which exists in some states right now. It's a cooperative health plan. In some states, they've had success. So there's a number of ideas out there. What the president wants is to explore all those ideas, but in the end of the day, he thinks a public plan is the best way to achieve what he's trying to achieve, which is to make sure that people have choice and competition and that they have some affordable options available to them.
Great. Dang is a political science college student in California, and he wants to know, when the healthcare plan covers more uninsured, how will our current system not be stretched thin?
Well, Dane may be thinking about going into one of the health professions, and I hope that he is. We do have certain areas of the country right now where we need more primary care nurses and doctors. We know that the healthcare system needs more emphasis on primary care and prevention. All of us as people need that. We need to concentrate on keeping ourselves well as opposed to showing up sick later when it's much more costly and we lose productivity in our jobs. So we do need more people to go into that healthcare workforce, and the President's plan will encourage that. We've already made some big investments in that in the Recovery Act that Congress enacted earlier this year. So in any event, we know that as a country we need to make more investments in getting the right kind of health professionals and clinicians trained to serve people. And the nurses, in fact, were here today, the American Nurses Association. They're enthusiastic about health reform. They endorse the President's efforts, and they agree with us that we need to train more people to be nurses, and we're going to work with them to make sure that happens.
We have a question submitted to Twitter about, will insurance be portable? If I leave a job, can I take insurance? Can I get insurance?
Well, one great thing about the exchange is that if you leave your job, you will be able to go to the exchange and purchase insurance. And right now, it's only portable when you leave your job, to the extent that if you are eligible, you can get COBRA, and you can keep your coverage for a period of time that way. This way, if you lose your job, if you leave your job, you'll be able to go to the exchange and purchase similar coverage. It may not be the exact same plan that you had on your job, depending on what your employer offered, but you'll be able to purchase coverage. So it does give you that security that right now you don't have. Right now you're on the individual market out there trying to get the information and see what might be available. So we hope this will give you many more choices and better affordable options.
We just got a question to Twitter about consumer protections. What health reform will change about the current system?
Well, will be a lot more consumer protections. Right now, in the insurance market, it happens all too often that people get dropped when they get sick. There's nothing that requires an insurance company to have any limits on how much they can charge you for out-of-pocket costs. There are no limits on your annual, there are limits on what the kind of coverage you can get annually and your lifetime limits. And you hear all too often about people who go bankrupt in part because they get sick. This morning in the meeting that the President had with the American Nurses Association, there was a nurse there who has written about a patient of hers who recently in his 60s had been in the insurance industry, didn't realize it, but his coverage had limits. He got cancer. Spent his last 3 years of his life 3 months of his life trying to figure out how to pay for his care. So there will be protections around that and regulations around how insurance companies can operate in the future under health reform that aren't there now. Right now, there's no guarantee if you have pre-existing conditions that you can even buy an insurance policy. That will be gone when the President signs this new law. So there will be a lot more consumer protections for people. And also there'll be more transparency around what insurance companies are doing in terms of their minimum loss ratios and how much they're charging people. It will be a new day.
Frank is a small business owner, and he is worried about what is going to happen to him under health reform.
Well, if Frank already provides health insurance for his workers as a small business, first, thank you for doing that, because we know you haven't had to, and we appreciate that you're doing right by your workers. You'll be eligible for tax credits under health reform to help you afford to continue to provide coverage. You will likely, depending on the size of your business, small businesses under 50 employees or so will be exempt from any mandate to provide coverage. They will be eligible for tax credits, and if your workers will have the opportunity to go to the exchange and purchase more affordable coverage. So we think you will be a winner. We think small businesses should really benefit from health reform.
We've had a lot of questions about timing for a health reform proposal. When would it take effect, and how would it take effect?
Well, there'll be parts of this. The President, we are committed to getting this done this year. We've waited so long. You heard the President talk last night about how the efforts to get comprehensive health reform date back to at least President Teddy Roosevelt. So we've been at this for decades. If the bill gets enacted in the next few months, then the exchange itself probably wouldn't become operational till 2013, because it takes a while to get all of that set up. But immediately, some changes could start to occur. One thing that the President talked about last night is if you're an American who's been unable to get coverage because of a pre-existing condition, which happens to a lot of people if they lose their job, or let's say they go off on their own to start a company and then they would like to buy insurance, and if you have a pre-existing condition, it can be almost impossible or prohibitively expensive. So if you're uninsured because you have a pre-existing condition, you'll be able a year from now, assuming this bill passes this year, you'll be able a year from now to be part of a new high-risk pool that we're going to establish to enable you to purchase coverage much earlier. The medical malpractice demonstrations that we talked about earlier, Jen, those we want to be set up sooner as well. So there will be some benefits, some of the new regulations about insurance companies requiring them to guarantee the renewal of policies. If you have a policy, the company can't drop you because you get sick. Some of those insurance market reforms will take place immediately. Some of the new savings will come into place before reform starts. But the exchange itself, the subsidies to help people purchase insurance or tax credits, those will probably not take place until 2013.
Ryan has a question and wants you to describe what exactly is the health insurance exchange.
The exchange, if you think of it, it's just like a marketplace. So all of you are participating via the internet now, and I find an easy way for me to think about it is the way that I go online now to purchase things, and there are many websites that you can go to that give you, if you're looking for a particular item, they'll give you, well, here's how much it costs at this store, here's how much it costs at this one, here are the features of it, and you can comparison shop. And that's a little bit how the exchange will work. And because it won't be just me purchasing, it'll be millions of people all pooled together, we'll be able to have more leverage and get a better price for buying insurance that way. So that's sort of how it will work. It's a marketplace to pool people's risk and to help them be able to purchase at a better price.
We just got this question to Twitter. How does government-backed health care for low-income families compete for customers big insurance companies don't want?
How does it compete? Well, we hope that big insurance companies are going to want low-income families when they have subsidies to help them afford insurance. We think they will want them. And remember, we're going to be reducing the administrative costs of those big companies too. Right now, they have incentives under existing law when they are looking for customers to cherry pick, to pick the people who are the healthiest, who will have the lowest cost. Under the new system, those kinds of practices won't be allowed anymore. They'll need to be able to take everyone, and everyone's risk will be pooled. So we think it'll be a good deal for the insurance companies to cover these people, and they'll be required to do that if they want to participate in the exchange. We think having 30 million more people coming into the insurance market will be something that insurance companies will want to participate in. And the public option will just be an option there, totally voluntary, for the providers who want to participate and the people who want to participate in it. And we think that that'll be a good competitive force to have in there in that market as well.
Okay, looks like we have time for one more question, and it's a question that asks about veterans. How will the new health care affect retired veterans and disabled vets?
Well, for veterans, first of all, again, thank you for your service and for what you've done for our country. And you should not see any changes. This new health care system really doesn't apply to you. It applies to people who don't have insurance. If you're covered right now through the veteran system, you will continue to get care the way that you always have. Nothing will force you to change that at all. However, many veterans don't actually use the veterans healthcare system. They are in the private sector, and so if they are people who don't have insurance now, or they're a small business owner or a person in the individual market, they'll have access to this new exchange. And if they're low income, they'll have access to the subsidies or tax credits just like everybody else.
Great. Well, thank you so much, Nancy Ann, for answering these questions submitted after the President's speech to Yahoo News and through Twitter. We really appreciate you and all of your interest in health insurance reform. We hope you learned information, and thank you again.
Yes, and I should urge people to go to our website, which is www.healthreform.gov.
Thank you.